Hey guys, this is Curtis Alexander. I'm a pharmacist. In this video, I'm going to be covering Baclofen, just the basics, dosing, side effects, those sorts of things. Just go through the whole thing. And just so you guys know, I get a lot of questions, but one of the questions I get pretty frequently is, what are things I can take or do that can help me maybe get away from prescription drugs and those things? So go to Curtis-Alexander. I have a free report there for you, and it goes over some of the things I know to work that I use myself. So at any rate, let's hop right into it. So Baclofen is basically a muscle relaxer. I did another video on cyclobenzaprine, muscle relaxers. There's going to be some similarities with them. So as far as what they do in your body, basically when you take it, it's going to relieve muscle spasticity. And surprisingly, there's theories about how it works. We don't know totally for sure, but basically, and you're going to see from the side effect profile, is that one of the things it does is it makes you very tired, and that's also how it relaxes the muscles. How fast will it work? People always want to know, when I take a dose, how fast will it work? Generally speaking, your body's going to reach peak blood levels when you take it by mouth anywhere from a half hour up to as long as 4 hours. Okay, so I would expect most people see significant changes within that half hour to 1 hour time frame. Now, the thing we need to remember is food can affect that, all right, and GI function can affect that because it's absorbed in the gut. All right, baclofen, that's how it's absorbed. So it's dose dependent on how fast it's going to work. It's also dependent on the function of your gut, those sorts of things. Okay. Another good question is, people will go, I've started Baclofen, I've been taking X amount of time, can I experience withdrawal? Now, I've talked about this before with other classes of medication. The shorter the half-life, meaning how quickly it gets out of your body. If a drug gets out quick, the severity of withdrawal symptoms can be bad. Not bad, but they can be worse. And you see those short half-lives with Baclofen. Okay, so yes, withdrawal can happen. It can be serious. So you want to be very careful, particularly if you've been on it for any length of time. You do not want to cold turkey. You want to talk to your doctor and go off it slowly. Okay. So uses. Ironically, it's not just for muscle spasms and spasticity. You can actually see it used for hiccups. I just wanted to throw that in there because I thought it was kind of cool. Dosing, they'll usually start you out 5 to 10 milligrams. TID is 3 times a day, as needed. You definitely want to use it intermittently, meaning ideally what you want to see is somebody start out with a low dose of Baclofen. I usually recommend people get it towards the evening, so maybe a 5 milligram tablet at bedtime. Do you wake up like really groggy the next day? If so, we want to be careful about adding in day doses, during the daytime. But start low, go up slow, and use intermittently, no more than 2 or 3 days at a time. That's the ideal. Now, do people get put on it long term for certain things? Yes, they do. We can see it for multiple sclerosis patients who need muscle relaxers, those sorts of situations. But ideally, we don't want people on it long term. Okay, now some concerns. If you're anybody that, if you have kidney problems, if you have GI problems, slow transit times in your guts, you want to be careful, because we can see some of these people with respiratory, kidney, GI issues. Those organs can be slowed down, and if they're already slow to start with, you could run into problems with Baclofen. So go careful, go slow in that case. Excuse me. If you have a seizure issue, it can, I don't want to say lower your seizure threshold, but we can run into problems with people with seizure disorders. And it can also make psychiatric symptoms worse. For example, people with schizophrenia, there can be what we call CNS depression, central nervous system depression, with Baclofen. So people, confusion, schizophrenia, we want to be careful with those folks. Again, what we're saying here is not that you can't take Baclofen, it's just that you want to be careful. Now, how about side effects? When people get muscle relaxers, one of the first things I say is basically it works by putting you to sleep. So we see drowsiness in 63% of users. Hypotonia is basically like low muscle tone. Think of it like a baby's inability to hold its head up when they're very little. They don't have a lot of muscle tone. We can see that in anywhere from 2 to 35% of people. Why the wide range? Because it depends on the dosing. So the higher the dose goes, the more of that hypotonia that we're going to see. Again, dizziness, 2 to 15%, also a wide range because of the dosing. Asthenia is just weakness, basically is what that means, 15% of folks. And then nausea and vomiting, 11 to 12%. So, but you know, by far and away, the biggest side effect is going to be the drowsiness component. So, kind of wrapping things up, let me know in the comments, have you taken Baclofen? How did you tolerate it? Were there side effects? What did you think of it? It helps me, it helps other people who end up watching the video, so I really appreciate you doing that. It's helpful. And speaking of helpful, I hope this video was helpful, and I will see you in the next one. Thanks.